Hi everyone, this is Dr. Corolla Okogbaa, and I'm back with you all again this week. We are midway through January, and January, like we talked about last week, is Glaucoma Awareness Month. And so I'm your comprehensive ophthalmologist and coming on to talk to you a little bit more about glaucoma. Okay, so one of the questions that I get a lot is, Doc, how do I know I have glaucoma? Okay, so we're going to delve into that today. Last week we talked about how glaucoma is an important condition in the eye, and it actually has a whole month is dedicated to the awareness of this condition because of its importance. 3 million people in the U.S. Is estimated to have glaucoma, and it costs our economy $2.8 billion in cost and in a loss of productivity. And the tricky thing with glaucoma is that you can lose eyesight without even knowing it. Okay, and so that's one of the very important things to know about glaucoma. All right, so last week we talked about who's at risk. We talked about how if you're a person of color, if you're African American or Hispanic, your risk of developing glaucoma is actually 8 times that of someone of Caucasian ancestry. Okay, and so it's very important to get your annual eye exams and things like that to and we talked about if you have a family history, race, age, different things that put you at risk for developing this condition. Okay, so today let's address, well, how do I even know I have glaucoma? Can I feel it? Can I see it? And so the answer really is most of the time, no, you don't know you have glaucoma, because glaucoma tend to be sneaky and it's a silent blinder. And so many times for you to know you have glaucoma, particularly what we call primary open angle glaucoma, which is the most common type of glaucoma here in the US. This is the type of glaucoma we're talking about today. For that particular type, typically, it's not until the advanced stage when you are losing vision in your peripheral eyesight, your peripheral vision or your side vision. And at that point, it's usually end stage or it's usually very advanced. And that's when you can know that, yeah, I can definitely see that something's been going on in my peripheral vision, and the diagnosis, it could be glaucoma. But for most people, it tends to be an incidental finding, or where something in your examination while at the eye doctor looks suspicious for glaucoma, or you have a family history and that brings you in to get checked out, and we run some tests, and lo and behold, it may show that you have you have this condition. Okay, so let's say when you do come to see the eye doctor, we always screen for certain things in the eye exam, looking for anything that could be suggestive of possible glaucoma. Okay, so we check the pressure in the eye. We do an examination from the front of the eye to the back of the eyes. Okay, we look at the angles of the eye to see how the fluid in the eye is draining. Whether the angle is open or it's closed, that gives us some clues. And of course, looking at the optic nerve, which is the area of the eye that that tends to get damaged over time from glaucoma. Okay, so we look at your exam, and then with all of that, next we do some tests to actually verify or to quantify or to see whether it's glaucoma or in what stage, if it is glaucoma, what stage is the condition. So after you do your exam, usually the doctor will have you do other tests. One of this tests is called a visual field test. And what that does is it helps to test your peripheral. It looks at your peripheral vision or your side vision, looking for any spots or scotomas or areas that you are not aware of, but these tests can pick it up, and that will let us know if that is early glaucoma or if it's progressing a little bit further at that point. So that's one big test that not only do we use to diagnose glaucoma, but we also use that to monitor the progression of glaucoma. Okay. Another test and other things that we do for the eye to help in the diagnosis of glaucoma is taking the imaging of the optic nerve itself. So we have advanced technology now where we can actually look at the health of the nerve fiber layer, the nerve itself, the tissue, to see how healthy it is, to see how advanced the damage is in the nerve. Okay, because sometimes we may have one test that show us a particular result and another test shows us something different. So with glaucoma, it takes multiple testings or different tests, as well as eye examination, pressure, and your risk factors to give us a real good conclusion as far as to say whether, first of all, whether you even have glaucoma, because sometimes the eye may look suspicious for glaucoma. Sometimes some people come and say, oh, years ago, the doctor said my nerves in the back of the eye were big or they were a little large and that I should keep a check on them, but it's not glaucoma. It's just the way I was born. We call that physiological cupping of the nerve. So basically, it's the eye may look like you have glaucoma and it's not. So it requires us to do use multiple modalities to see whether or not you have glaucoma. Okay. So we talked about these tests and things like that. And then the tests will also help us to determine at what degree, what stage. Is it in the beginning? Is it moderate? Is it in stage? And all of that not only help us with the diagnosis, but it also helps us to see, it helps us in the treatment regimen for glaucoma, okay, which we will talk about next time, next week, as we continue on this journey of learning more about glaucoma. Next week, we'll talk about what the treatment, what are the different treatments. And of course, I'm going to address my favorite question these days is, Doc, can you write me a prescription for marijuana to treat my glaucoma? So I will address all of that next week, so stay tuned. But in the meantime, I hope you've been learning something about this condition. If you know someone who has glaucoma or have blindness in their family, or have not had an eye exam, or yourself may not have had an eye exam in the past year, I would recommend that you get your eyes checked, and we'd be happy to see you. I'd be happy to work with you and make sure those eyes are healthy. You can reach out to us on www.lacenterforeyes.com or call our office in the Baton Rouge area, Louisiana Center for Eyes. Okay. That is all I have for you today. I will see you next week. It is still Glaucoma Awareness Month. Have a good day.